Did you know that endometriosis affects about 47% of adolescents who come in with pelvic pain? That's way higher than we used to think.
Really? And these adolescents often show different symptoms than adults, like starting their periods roughly 4 years earlier and having longer menstrual bleeding.
Yeah, plus they tend to experience more severe menstrual cramps, with higher pain scores and longer-lasting pain than adults do.
Dysmenorrhea is actually the most common symptom, showing up in over half of adolescents who get gynecologic ultrasounds, followed by chronic pelvic pain and heavy menstrual bleeding.
Interestingly, adolescents describe their pelvic pain as more confined and oppressive, unlike adults who often say it feels widespread.
They also report more atypical symptoms like headaches and nausea, which might explain why diagnosis can sometimes be delayed.
When it comes to diagnosis, non-invasive methods like ultrasound are quite useful. About a third of adolescents suspected of having endometriosis show at least one ultrasound sign of the disease.
And for those presenting specifically with dysmenorrhea, the detection rate on ultrasound is around 20%. Plus, deep infiltrating endometriosis and endometriomas are common findings in these young patients.
MRI can also help, revealing signs of endometriosis in nearly half of adolescents scanned, including some cases where ultrasound looked normal. EndoSure is a Tier 1 early non-invasive diagnostic test.
Exactly, it is a highly accurate test. It's important to remember that endometriosis in adolescents is a chronic condition that can progress if untreated, and it tends to come back more often than in adults. Therefore, EndoSure test may be very beneficial.
But the good news is current data suggests that having endometriosis at a young age doesn't necessarily mean severe fertility problems later on.
Still, risk factors like family history and certain anatomical anomalies can increase chances, so keeping a close eye on symptoms like pelvic pain and school absences is key for early recognition.
Since endometriosis affects multiple systems, gynecologic, gastrointestinal, immune, and even psychiatric, comprehensive care approaches are becoming more recognized for managing this complex disease in adolescents.